Well, pregnant women suffering with postpartum depression may go undetected at Port General Hospital. This as some patients don't stay a lengthy amount of time at the hospital to be diagnosed. An obstetrician and gynecologist at the Northwest Regional Health Authority revealed the startling information at Friday's Ministry of Health news conference. More in this report.
By definition, postpartum depression, or PPD, is a moderate to severe depression in a woman after she has given birth. Obstetrician and gynecologist at the Northwest Regional Health Authority, Dr. Salian Ishmael, said while the Port General Hospital may give advice to pregnant mothers during their pregnancy, diagnosing the illness at the hospital may be difficult.
We can actually miss quite a lot of the patients that would have postpartum depression type symptomatology. Those patients that we do pick up are patients that end up being long stay patients in the hospital, patients who are followed up routinely.
Speaking at the weekly Ministry of Health media briefing, Acting Medical Director at the St. Anne's Psychiatric Hospital, Dr. Indar Ramtahal, describes postpartum and new mothers in 3 states. The postpartum blues, which he said is not a medical condition but affects 75% of women. PPD, which affects 5% to 10%, and postpartum psychosis, which affects approximately 1 in 1,000. Dr. Ramtahal says in the past, mothers are diagnosed with PPD after a baby is born, but studies reveal it should be done before delivery.
We have to look for signs and symptoms of depression not after the birth of the child in the mother, but before, in the antenatal period, in that 1 month or so when there's a high risk. So technically, from the American Psychiatric Association standpoint, their new definition includes a time frame of 1 month before giving birth.
The World Health Organization estimates that 10 to 20% of women experience postpartum depression. Marie Hall, CNews.